Welcome, everyone, to the very first episode of Complete Conversations. I am so excited you're here with us today for our deep dive into, well, everything. Health and wellness, that is.
We've got lots of really great stuff planned for you. Lots of fun and interesting information, too.
Yeah, we're going to be talking about things like how to stay healthy, healthy living tips, how to make good choices for your life, and how to keep your mental health strong, too.
We want to help you live a healthy, happy life. We're your friendly guides.
That's right. And speaking of guides, we should let everyone know that we have a little secret to share.
Right. We, your hosts, are actually powered by Google AI.
Pretty cool, huh?
It just means we're really good at finding information and explaining it.
Exactly. And so for our very first deep dive, we're going to be talking about something that's really important to us. We're going to be talking about CompleteCare Health Network. You might know us as that place in your neighborhood that provides health care.
Right. But we're more than just a place to go when you're sick.
Right. Okay, so let's start with the basics. What exactly is CompleteCare Health Network?
Well, we're what's called a community health center. So that basically means that we want to make sure everyone has access to health care, no matter what your income is or whether you have insurance or not.
What makes CompleteCare so special, though? I mean, there are other health centers out there.
Well, yeah, that's true. But, we've been around for a really long time, over 50 years, and we serve over 60,000 patients a year.
Wow. So that's like a whole mid-sized town.
Yeah, it is.
But it's not just about the numbers, right? I mean, what really makes CompleteCare different?
Well, it's really about going above and beyond. We're not just about treating you when you're sick. We want to help our whole community be healthier.
So it's more like you're looking at the whole picture, not just like putting Band-Aids on things.
That's right. We want to help people live their best lives. And that means, trying to keep people from getting sick in the first place and teaching people how to take care of themselves. We really want to understand what our community needs.
That's great. So how does CompleteCare actually do all that?
Well, we have a mission statement, and it says that we want to improve people's lives by giving everyone easy access to high quality and complete health care.
Okay, that makes sense. So what's the big dream? What does CompleteCare want to be in the future?
Well, our vision is we want to be a good example for others. We believe everyone deserves great health care, and so we're working hard to make that happen.
Sounds ambitious.
Yeah.
I like it. Okay, so how do we actually, put those ideas into practice?
So we focus on 5 main things. So first of all, we want to understand what our patients need. Like, what kind of problems do they have? What kind of care do they need to really thrive?
So it's like getting to know your patients like people, not just a list of symptoms.
Right. Exactly. And then second, we work closely with the community to make sure that healthcare is affordable and easy to get. We don't want people to avoid getting care just because of money.
That's so important.
And the third thing is we love technology. And so we're always looking for new ways to use technology to make things better and to work better together. And that includes things like our patient portal.
The patient portal. Tell me more about that.
Okay, well, the patient portal is basically a website that lets you manage all your healthcare stuff. So you can make appointments, order refills, look at your records.
All from home.
Yep, all from home. You can even send a message to your doctor.
Wow. So it's like having your own personal healthcare assistant.
Yeah, pretty much.
Awesome. Okay. So we've talked about the big picture, the mission and vision and stuff. But what about what kinds of services does CompleteCare actually offer?
Okay, so we offer a lot. We have all the basics like regular checkups and treatment for common illnesses for adults, kids, seniors, families.
So the one-stop shop for staying healthy?
Yeah, you could say that. But we also offer a lot of special services too, like women's health. We have prenatal care for expecting moms and everything else women need.
So whether you're starting a family or you've already got one, CompleteCare is there for you.
That's right. And we also know how important mental health is, so we have counseling, psychiatric care, and support for people who are struggling with addiction. And we even have crisis support if you need someone to talk to right away.
It's so great that CompleteCare offers such a wide range of mental health services. It's just as important as physical health.
We think so, too. And we're not done yet. We also have all kinds of specialty services like internal medicine, foot care, infectious disease treatment, kidney care, and even chiropractic services.
Wait, chiropractic too? Wow. I didn't know CompleteCare had all that.
Yep. Like we say, we've got you covered from head to toe.
So basically, if you need health care, you can go to CompleteCare for just about anything. But what about people who might be worried about the cost? I mean, healthcare can be expensive.
That's a really good point, and we really don't want anyone to avoid getting the care they need because they're worried about money. That's why we have something called a sliding fee discount program.
Oh, okay. What is that?
So basically, how much you pay is based on how much money you make and how big your family is.
Oh, that makes sense.
So even if you don't have insurance or if your insurance doesn't cover very much, you can still get care at Complete Care without going broke.
That is awesome. No one should have to miss out on healthcare because of money.
Exactly. And we also have something called access to care counselors.
Access to care counselors. What's that?
They're like, financial superheroes.
Financial superheroes. I love it.
Yeah. So they help people figure out how to get insurance, because it can be really confusing.
It really can.
So they can help you apply for Medicaid or Medicare, or even find a good private insurance plan that you can afford.
So no matter what your situation is, Complete Care can help you get the coverage you need.
Yep, that's our goal.
And of course, you also take regular insurance too, right?
Yeah, most major insurance plans.
Okay, so let's say someone is ready to check out Complete Care. Where can they find you?
Well, we have locations all over southern New Jersey. We have big offices in Bridgeton, Millville, Vineland, and Wildwood, and more.
So no matter where you are in South Jersey, there's probably a Complete Care nearby.
You got it. And if you want to find the closest one to you, you can just go to our website.
Speaking of the website, I hear there's something called the Complete Care Foundation. What is that?
Yes. The Complete Care Foundation. Well, it's basically our own nonprofit organization, and it's dedicated to supporting even more community health programs. They do some really amazing work.
Like what?
Well, they have this really cool program called Vet Smiles.
Vet Smiles. What is that?
Well, it's a program that gives veterans free dental care.
Oh, that's so nice. Veterans deserve that.
We think so, too. And they do a lot more than that, too. They have a program called Baby Love that helps pregnant moms. It gives them support during their pregnancy. They even give them gifts to encourage them to take care of themselves and their babies.
Oh, I love that. Every mom deserves to feel supported during their pregnancy.
And they have this other program called Health Solutions that brings kids from local schools to Complete Care so they can get medical and dental checkups. Just making sure they're getting the care they need from a young age.
It's all about starting them off right.
Yeah. And speaking of starting kids off right, they also support a program called Reach Out and Read.
What's that?
Well, it's a program that gives books to kids under 5 during their checkups.
I love that. It's never too early to start reading.
I know. So yeah, the Complete Care Foundation is doing a lot of really great things to make our community healthier.
It sounds like they're really going above and beyond.
Yeah, they are.
But we can't forget about all the people who work behind the scenes. So let's talk about Complete Care's leadership team. Who are the people that make all this magic happen?
Okay, so first, we have our amazing president and CEO, James Curtis Edwards. He's been with Complete Care for over 20 years.
That's longer than some of our listeners have been alive.
Talk about dedication.
Right. He started with Complete Care back in 2004 and worked his way up to CEO. He even served in the U.S. Navy before starting his career in healthcare.
Wow, that's impressive.
He clearly has a strong sense of service.
And he doesn't just work at Complete Care. He's also on the Bridgeton City Council.
Oh, wow. So he's really involved in our community.
Yeah, he's a true champion.
I like that.
Yeah.
Who else?
Okay, so then we have our amazing chief medical officer. Her name is Dr. Aziza Saloom. She's in charge of all of our medical providers, and she makes sure that everyone is giving really great care.
That's a big job.
It is. But she still makes time to see patients every week.
Really? Wow. That's impressive.
Yeah, she really cares about our patients.
That's awesome. And I know there's a whole team of really talented leaders who work so hard to keep Complete Care going and make sure our patients are getting the best care possible.
Right. So we have Richard Elwell, who's our Executive VP of Business and Operations. He's the one who makes sure everything runs smoothly. And in his free time, he volunteers with youth programs.
That's great. He really cares about Complete Care in our community.
Oh.
So who else is on the dream team?
Okay, so we have Megan Spinelli. She's our VP of Community Services and Infection Control. And get this, she used to be a medical specialist in the Coast Guard.
Wow, that's an interesting background.
I know, right? Then we have Robert Moran. He's our Director of Facilities and Corporate Compliance. So he's the one who has to make sure that all 19 of our locations are safe and accessible.
19 locations, that's a lot.
It is. And then there's Dr. Selena Asante, our dental director. She's really passionate about making sure everyone has access to good dental care. She's even worked with mobile dentistry programs for kids, bringing dental care right to their schools.
That's so cool.
It is. And then, of course, we also have Kimberly McCargo, our Director of Quality and Population Health Services. She's been in public health for over 20 years. And she always wants to make sure that we're doing the best we can for our patients.
That's good. You always got to be improving.
Definitely. And we have Darlene Clendaniel, our director of nursing, who's in charge of all of our amazing nurses. And she has a special interest in mental health and helping people recover from opioid addiction.
Wow, that's really important work.
It is. And of course, we can't forget Salita DeMary, our director of marketing. She's the one who makes sure everyone knows about all the amazing things we do.
Yeah, you got to spread the word.
Absolutely. And last, but definitely not least, we have Inez Acosta. She's our chief legal officer. So she makes sure that everything we do is, legal and follows all the rules and is in line with our mission.
That's so important, too.
It is.
Wow. What an amazing team.
I know, right?
No wonder CompleteCare is such a success story.
They really are a dedicated team.
It really takes a village, huh?
You know what they say.
So speaking of villages, I know CompleteCare has a lot of partners.
Oh, yeah, we do. We believe that collaboration is key to building a healthier community. So we work really closely with a bunch of different organizations that, also care about health and wellness.
So CompleteCare doesn't do all this awesome work alone.
Nope. We've got a lot of great friends.
So who are some of these awesome partners? Tell me more.
Well, we're proud to partner with groups like the Gloucester County Board of Social Services.
Yeah.
And Cape Regional Health System and the Cumberland County Alcohol and Drug Abuse Services.
So it's not just about medical care. It's about understanding all the different parts of a person's life that can affect their health.
Absolutely. We also partner with the Cumberland County Collaborative and the Cumberland County Guidance Center and even Cooper Health System hospitalists.
Hospitalists. What are those?
Basically, hospitalists are doctors who work in the hospital, and they take care of patients while they're there.
So they're like extra experts who are watching over you when you're in the hospital.
Yeah, you can think of it that way. So they work closely with your regular doctor and specialist to make sure you're getting the best care possible. And then when you leave the hospital, they make sure you have a smooth transition back home.
It's all about working together.
Exactly. Teamwork makes the dream work.
I love it. So who else is on this list of impressive partners?
We also work with the Foot Health Center, LabCorp, Nemours Children's Health System, and Inspira Health Network.
That covers a lot of ground. Wow. So from specialized foot care to kids' health to big hospital networks, you guys really do work with the best.
That's right. And there are more. The South Jersey AIDS Alliance, the New Jersey SNAP Education Program, the Center for Human Services, and Gateway Community Action Partnership.
It sounds like CompleteCare is really plugged in to the community, connected to this whole network of people who are working to improve the health of our community.
We are. And we also work with the LIFE program.
The LIFE program. What's that?
It stands for Living Independently for Elders. It helps senior citizens stay in their homes as they get older by providing them with support and services.
Oh, that's great. A lot of seniors really want to stay in their own homes.
It's important for them.
It is.
And here's another great example. We also work closely with the National Association of Community Health Centers and the Cumberland County Health Department, the Gloucester County Health Department, and the Cape May County Health Department.
Oh, wow. So CompleteCare is working with other health centers and local health departments to make sure that everybody has access to the health care they need.
Right. And NJ Family Care, Tri-County Community Action, the Joint Commission, New Jersey WIC.
Wow, so many.
And even the State of New Jersey Department of Health.
You guys have a lot of partners.
We do. We believe in working together to make our community healthier. Speaking of working together, I want to talk about something that's really cool that CompleteCare does. It's called the Patient-Centered Medical Home Model.
Okay. Patient-centered medical home model. I have to admit, I don't really know what that means.
Well, it's all about providing really personalized care. So, imagine having this whole team of healthcare professionals who are just dedicated to you and your health goals.
So it's like having your own personal cheering squad for your health.
You got it. And the best part is that you're, like the star of the team. Your needs and what you want, those are the most important things.
So it's not just about the doctors telling you what to do. It's more about working together.
Right, exactly. It's about having a good relationship with your doctor, one that's based on trust and honesty and, working together to make decisions.
That sounds awesome. So how does this patient-centered medical home model actually work? Can you give me a real-life example?
Sure. So, okay, let's say you have diabetes.
Yeah.
With the patient-centered medical home model, you would have a whole team of people working with you to manage your diabetes and to help you stay as healthy as possible.
Okay.
And so that team might include your primary care doctor, a nurse, a care coordinator, maybe even a nutritionist or a diabetes educator.
Wow. That's amazing. So you got all those experts helping you out.
Right, and it doesn't even have to be just medical professionals. It could include your family or caregivers, too. Anybody you want to be involved.
That's so cool.
Yeah.
Healthcare is not just about doctors and hospitals. It's about having the people you love support you, too.
Exactly, and the patient-centered medical home model really gets that. It's about looking at your whole life
Right.
and all the different things that can affect your health.
Right. Like, you're more than just your illness.
Exactly.
I am really impressed with CompleteCare's dedication to this model of care. It's really cool and kind of futuristic, you know?
Yeah, they are really forward-thinking. They really are. They want to provide the best and most personalized care that they can.
You know, we've covered a lot of ground today, but there's always more to learn about Complete Care and the world of, health and wellness. We encourage you to check out their website, explore their services, and maybe even schedule an appointment. You might be surprised at what you discover.
Shoot us an email at completeconversations@chcinj.org or give Complete Care a call at 856-451-4700. And be sure to join us next time for another exciting episode of Complete Conversations, where we'll continue to explore the fascinating world of health, wellness, and more.
Until then, remember, this deep dive may have been powered by AI, but the impact Complete Care is having on our communities is very real. Take care, everyone.